At the cornerstone of all of our wellness programs is eating properly, healthy foods, right? At number one. Number two, exercise. Exercise, doing some type of movement. Number three, stress reduction. Okay, stress very important. We talked about stress a couple of days ago, and we have some excellent stress formulas depending on what type of stress you have. So that is an area. Come see me afterward. And then using the right supplements in the right dosages, what we call therapeutic dosages, because a lot of supplements put very teeny tiny amounts of the actual ingredients that you need to get the benefits. So we use much larger amounts, and then we combine a lot of different things to give you the maximum benefit. And so that's really the cornerstone of all of our programs. So today Doc wanted me to talk about something that we get asked a lot of health questions about the heart, cardiovascular health. Okay? So the cardiovascular is so widespread. And it affects everybody on some level, right? So everything from major heart issues, heart attacks, stents, AFib, regular heartbeat, congestive heart failure, to things such as high blood pressure, to cholesterol issues, and everything in between. So it's very, very wide scoping when we talk about cardiovascular health. So we're going to share with you how we look at those issues, and might be a different approach than the conventional medical doctors, and what we can do nutritionally to really jumpstart those programs as long as you're doing everything else right. So it's very interesting. February, we just had February here. February is National Heart Awareness Month. And other than Dr. Oz, who spent the entire month talking about the heart, I did not see one other single news media outlet even once discuss that. So you have all of these other diseases of the month and conditions of the month, and let's put a bucket on your head, and that's all great, but cardiovascular health should be discussed the most because it's still the #1 killer in the United States. And not one single media outlet did I hear about it. I don't know if you caught it anywhere else. I didn't. Very, very strange and peculiar, I would say. So #1 killer, it's right there with cancer, neck and neck, depending on what stat you read. 64 million people live with cardiovascular disease every day. 600,000 people die of heart disease every year. 1 in every 4 deaths contributed to the heart. So again, very, very wide scoping. And again, if this doesn't affect you personally, definitely someone in your family. We know that. So this really should be very, very at the primary importance. And then there's the cholesterol connection here. High cholesterol. People with high cholesterol have 2 times the risk of heart disease than people with lower levels. But is that the end-all be-all? So I have a little trivia question here for you today. Okay, little Jeopardy. What percentage of people who have a heart attack actually have normal cholesterol? 0%, 25%, 50%, or 100%? B, C, C, B, D. Okay, the answer is, drum roll, C. 50% of the population have heart attacks, have absolutely normal cholesterol levels. 50%. So, we always ask the question, what is more dangerous, the cholesterol or the medications that they're using to lower it?
That's what I was going to ask you. Is that normal cholesterol with medication?
No, this is not with medication.
Okay.
Or some people it is. You know, that's a good question, but believe it's not with medication. Okay, they actually have normal cholesterol, so the medical doctor didn't put them on anything. Okay, so we know that's not the end-all be-all. It's just looking at cholesterol. Is it one piece of the puzzle? Yes, but a very large piece of the puzzle. And we'll show you some newer lab tests to specifically ask for when it comes to the heart and cholesterol here in a moment. But we know statins, these are cholesterol-lowering medications. So this is your Lipitor, your Zocor, things of this. Anything that ends in a statin is your cholesterol-lowering medications. Big business, huge business, $20 billion per year drug companies are making. That's just the United States. That's not the world, by the way. Huge business on the statins. Unfortunately, with the statins come the side effects. And this is called a PDR, Physician's Desk Reference, but you can simply Google this. If you have internet access, all you do, and this goes with any medication, any drug, you should always do this, is simply just type in the drug, Google it, and type side effects, and just print it out. So these are the symptoms and side effects of taking your Lipitor at normal recommended dosage. Abdominal pain, abdominal heart, or abnormal heart, accidental injury, allergic reaction, memory loss, dementia, Alzheimer's, arthritis, back pain, bronchitis, calcium deposits, chest pain, congestive heart failure, constipation, type 2 diabetes. The latest statistics, if you have been on a statin drug for 5 years or longer, it will absolutely cause type 2 diabetes. Type 2 diabetes. Most people have never heard of this. It's right on the insert. It's right on the instructions. This might cause diabetes. So that's a shocker for people to see that. Diarrhea, dizziness, fluid symptoms, fluid retention, gas, headache, indigestion, infections, inflammation, sinus, insomnia, can't sleep, joint pain, liver failure, muscle aching or weakness, nausea, rash, sarcopenia, which is muscle wasting, stomach pain, urinary tract infection, and weakness, right? So they rattled this very quickly on the drug ads, super fast. Okay? So when I talk to people about side effects, I said, did the medical doctor ever tell you about the side effects of taking your cholesterol medication? No. Not one word. Did your pharmacist, when you filled the prescription, tell you about the side effects from this medication? Only if I ask. I work with pharmacists. They have 60 seconds to fill every script that comes through the door. They will not tell you the side effect unless you ask. I ask them the question. And if they do tell you, it's only a couple. They don't go through this entire list. Okay, so this is shocking for people to see this for the first time. And you can do this with every drug. Every drug is like this. By the way, blood pressure medication is double this list. Taking blood pressure is double the side effects. Blood pressure medication. Very, very dangerous, okay? Especially the longer you're on it. The longer you're the drug, the more potential for all these side effects, okay? What they're seeing now, besides diabetes, dementia and Alzheimer's. Dementia and Alzheimer's becoming a major problem with people on these statin drugs because your brain is 70% good cholesterol. If we lower our cholesterol too low, guess what? We start losing brain function. There are thousands and thousands and thousands of lawsuits against Lipitor causing dementia and Alzheimer's. There's a very famous astronaut, Buzz Aldrin, okay? Very smart fellow. They put him on Lipitor. He went mentally insane on Lipitor. They found him in his front yard, completely naked, mowing the lawn. Okay? Since he took on Lipitor, his family said he was never the same on Lipitor. He wrote a book about it. They took him off Lipitor within 30 days, completely normal. Completely normal. Okay? So this is a major, major problem with the drugs. And the reason why most people, I should say, let's go back to the side effects here. So the most thing that most people feel on the statins is muscle pain, muscle tightness, Charlie horses, and muscle cramping. That's what most people notice on these cholesterol drugs. And the reason why this occurs is very simple. It depletes CoQ10. CoQ10 is a very important nutrient that's in your mitochondria, where energy is made in your cell. This used to be debated. Medical doctors used to say, oh, that's not true. Oh, that's just a theory. No, no way. Wrong. It's actually been proven. There are numerous studies that shows this. It reduces CoQ10 by at least 40%. 40%. We've seen some recent studies that are now up to 60 to 80% depletion of CoQ10. So if you're on a statin, very important. I'm going to share with you a couple studies here. Again, 99% of medical doctors have never seen these studies. Why? Because they've never taken one single nutritional class in med school, nor have they ever taken a nutritional class since med school. And that is the #1 question that you should ask them when they challenge you, when they tell you, oh, supplements don't work. There's no studies. It's garbage. You're wasting your money. It's expensive urine. Okay? Challenge them respectfully, very respectfully, challenge them. It's your body. It's your decision, not theirs. Okay, so here's a couple studies. Back in 2005, published study. People were on Lipitor, high levels of cholesterol, no evidence of heart disease whatsoever were put on Lipitor. 71% of them developed heart muscle problem that goes with heart failure. Almost 3 out of 4 people. They then gave them high doses of CoQ10, 300 milligrams of CoQ10 in this study, and half of them, it reversed. So we were able to save half of them. Unfortunately, couldn't save the other half. Okay? Published, studied. Published study, folks. Okay? Second study, this is on the pain one. 32 patients were experiencing side effects on their statin, muscle pain, called myopathic symptoms. 32 people. Half the group received 100 milligrams of CoQ10. The other half, vitamin E, 400 IUs. And then they just had a little pain and questionnaire score. After 30 days, the group receiving CoQ10, pain dropped by 40%. 40% reduction in pain. Pain interference with daily activities decreased by 38%, just by adding 100 milligrams of CoQ10. The group receiving vitamin E, no difference. So it was basically placebo. Okay? So if we just did one single thing for somebody, if you're on cholesterol medication right now, it would be CoQ10. How much do you need of CoQ10? This is also the most important thing, and most people do not take enough of it to see the benefits. So the published studies really show we need to be at 200 milligrams of ubiquinol or 100 milligrams of ubiquinol. And I'll go over that difference here in a moment. But that is what we need to replenish what the statin medications are taking out of our body. Okay? Just by doing CoQ10, we can help. And here's another shocking statement that people have never heard of. In 2 countries right now, in England and in Canada, it is required by law. If you fill prescription of a statin drug, you have to purchase CoQ10. In 2 countries, not 2 towns, not 2 cities, not 2 states, 2 entire countries, millions and millions of people, it is required. It is mandatory. Most people have never heard of this. That's how important CoQ10 is if you're on a statin. Okay? So, now with us, with CoQ10, we have a couple options. So we have the ubiquinol form. Ubiquinol, we have it in a soft gel, okay? So if you're using this, you want to do 2 a day, minimum. 2 a day. So I'm just going to pass that around for you. We have that in a 60 or 120 size. So the 60 would last you a month. The 120 would last you 4 months. We have the chewable. Chewable. So if you prefer chewables, sick of taking pills, we have the chewable option. Again, we have this in a 30, 60, or 120 size. We have samples in the back of this for you. Again, 2 a day. We also have a triple strength one. Triple strength one is 300 milligrams of CoQ10, 300 milligrams of another ingredient called dimethylglycine, DMG, which is my favorite supplement of all time because DMG does many things. We can say things about DMG that we can't say about any other supplement, but most importantly, it actually will methylize, it'll enhance any other supplement you take with it as well. So we'll talk about DMG here a little bit more in the next couple slides, but I recommend this one for major heart problems. So the major ones, congestive heart failure, heart attacks, stents, AFib, irregular heartbeat. I recommend this. I also recommend this for Parkinson's. Parkinson's. Okay? The research on CoQ10 for Parkinson's has been shown that high doses of CoQ10 slows down the progression of Parkinson's by 44%. 44%. There is no drug in the world that will slow down the progression of Parkinson's by 44%. Okay? One of the people we work with, his aunt has Parkinson's. She's had it for 18 years. When she first found out about it, we told her, you need to take CoQ10 and DMG. She's been taking CoQ10 and DMG for the last 18 years. She has no symptoms whatsoever of Parkinson's. So the earlier we catch it, the better. So if you, any major heart issues, 1 a day. For Parkinson's, 2 a day. And we just came out with it in a smaller size bottle, a 30 as well as a 60 size. Again, that is a chewable. And then lastly, we have Ubiquinol. Ubiquinol is the active form of CoQ10. So you have ubiquinone, which is what the other ones are, or you have ubiquinol. Ubiquinol needs to convert to ubiquinol in order to absorb it, okay, in order for your body to absorb. So there's a lot of studies out there that have shown that this is at least twice as absorbable ubiquinol as regular ubiquinone. So 1 a day if you're on a statin versus 2 a day of the ubiquinol. Okay, and this is a capsule, liquid capsule. Okay, so that is the difference between ubiquinone and ubiquinol. You can go with any of these. So we don't like to get into arguments which one's better, whichever one you prefer. So I just ask people ask me, do you have CoQ10? Yes, we do. We have chewables, soft gels, or capsules. What do you prefer? Oh, would you have ubiquinol? Yes, I do. That's the capsule. Okay? It's that simple. They're all good. They're all beneficial. If you or somebody in your family is on a statin right now, and almost half the country is, this would be the most important thing that you can do right now for them. And those muscle pains, the tightness, the Charlie horses will go away within days of just simply adding this one ingredient to your program. Okay? Before I move on, is there any other questions on CoQ10?
Yes. How come they don't put the DMG with the...
Because it would be double the price. And that's already a pricey product.
And that would not interfere with anyone taking medication?
Nope, it will not interfere with anything. Not interfere with anything. So, but that's why we have the DMG separate as well. You can do that, like we showed you. Okay? All right, so, yes.
If you're not on a statin,
Yes.
what's the recommendation?
100 milligrams if you're not on statin of ubiquinone. So just 1 a day if you're not on a statin for your heart. It's something I do every day. I personally, I'm work with a kinesiologist that tests me, like Dr. Weiner. He does muscle testing. She has told me that my body works best for the soft gel. So I use the soft gel personally every day in the morning, one every day. Okay, so
Would your body absorb the soft gel easier?
my body, that's what my body is telling me. Everybody's different, so that's why we recommend that you work with Dr. Weiner or somebody that actually specializes and tells you that specifically. Or just go by whatever you prefer. Okay? Yes? Yes, all heart issues. Okay? So that's what we're talking about. Now, moving on. If you were going through med school right now, becoming a medical doctor, this is what you're supposed to be doing. This is called the Adult Treatment Panel Number 3 Guidelines, ATP. This is by the National Institute of Health, National Cholesterol Awareness Program. This is not new. This has been around for 8 years. What medical doctors are supposed to do the first time you see them for an appointment, they're supposed to go over your diet, what you're eating. They're supposed to go over your stress. They're supposed to go over your exercise. They're supposed to go over your lifestyle. Take a blood test, and the second appointment, and only the second appointment after they review all those other lifestyle choices, based on your blood labs, are they supposed to recommend and prescribe a drug. Does that happen?
No, not normally.
Not ever. But that's what they're taught in med school. But then they get to the real world where they have 5 minutes to see everybody and you're trying to see as many people as possible in the real world, and here's your script, got to go. Okay, so we got to fill in the gaps. This is our program. This is what we're trying to teach people to do, these steps. Okay, lifestyle changes are the most cost-effective means to reducing cardiovascular disease instead of taking the pills. Everybody looking for that magic pill? There is none. Guess what? There is none. Now, this is the blood labs. They got this part down. They got this down really well. So your LDL, they want your LDL to be 100 or less. LDL. They want your HDL, your good cholesterol, between 40 and 60. Okay, so let's average that out. They want your total cholesterol right now, conventional medical doctor wants your total cholesterol between 140 and 160. Or they have to write you a prescription for a statin drug. Doesn't mean you have to take it, but a medical doctor can lose their medical doctor's license if they don't write a prescription for it. Okay? Now, I work with a lot of pharmacists that have gone through pharmacy school in the 80s. Duquesne, one of the most prestigious pharmacy schools in the country, right here in Pittsburgh, Duquesne University. What they have told me, what they were trained in the 80s, was that if your total cholesterol was 300 or higher, and only 300 or higher, only then would they write a prescription for a statin medical doctor. In the 80s. 10 years later, that number dropped to 250. 10 years later, that number dropped to 200. Now we're in 2015. They want your total cholesterol between 140 and 160. And guess what, folks? We've seen major organ systems start deteriorating below 160, such as your brain, which we just talked about, which leads to all the dementia and Alzheimer's, and your sex hormones. Your sex hormones need good cholesterol. All your hormones need cholesterol, but especially your sex hormones. So now you see all the ads, check your testosterone for guys. Do you have low T? You need androgel. You need testosterone boosters, testosterone drugs, right? Why? Because they've lowered your cholesterol so low that now you have erectile dysfunction issues for men. To sell you another drug. And guess what? The sex hormone drugs, they cause testosterone cancer. They've been linked to causing hormonal cancers. Okay? So this is the vicious cycle. People ask me, why would the pharmacists lower the cholesterol? Why would the American Medical Association, rather, why would the medical doctors keep lowering and lowering and lowering the numbers for cholesterol? 20 billion reasons why, folks. 20 billion reasons why they keep lowering the stats. Okay? Where would we feel total cholesterol should be 200? 200. But that's your choice. Okay? But we just wanted you to give a perspective on where a conventional medical doctor is coming from, because this is what they're being trained. This is what they're being taught right now. This is where they want the numbers to be. We totally disagree with this. Completely, 100% disagree with this. Okay? Just to let you know. All right. So we know the underlying causes. Right? No mysteries. Poor dietary, not exercising, smoking, eating the wrong kind of fats, the bad fats. We're going to get into that here, okay? So we'll show you another way to look at this here in a moment. Now I wanted to just give you this little slide. I love this one, perception. Perception is reality, right? So how much is a Big Mac value meal now? $5.57. Burger King a little bit more. Your high-end coffee drinks, Starbucks, let's just say between $3 and $4. How much is it for one of our shakes, either our super shake or a whey protein per serving? $2 at normally. Now it's $1.50 on a special today. But normally it's $2. But it's 30 servings. So people look at our container of our shakes and they say, oh, it's $60. That's way too much. I can't afford that. Meanwhile, the shakes are 2.5 times less than what they're eating at Mickey D's, which there's no nutritional value whatsoever. But they look at that price, value meal. Oh, it's value. It's saving me money. No, it's not. It's crap. Okay? So we just want people to be aware of this. When they're looking at items, we always reduce things to the per day. And actually, our shakes are very, very valuable on that level. All right, so testing. So this answers a lot of your questions here. People always ask us, what's the best cholesterol test? This is the test that we recommend, called the VAP test, V-A-P. The name of the lab company is Atherotech. Atherotech. Why? Because this has the most comprehensive blood lab panel out there that we've seen. And specifically, besides your HDL and LDL and total cholesterol and all that, what they're now testing for is these markers. One is called ApoA lipoprotein, and one is called ApoB lipoprotein. And these are derivatives of your HDL and LDL, and these are a much, much better indicator of heart disease than your HDL and LDL. Now, this is not new. This has been in the published literature. And I have a different slide. I added this, so you want to add this onto your presentation. So I apologize, it's not on your paperwork, but you want to write this in. ApoA and ApoB lipoproteins are the specific markers. This is not new. As I said, this has been around for 8 years at least in the published medical doctors' journals for 8 years at least. But most medical doctors do not test for this. You can request it. A lot more labs are starting to test for this. So just like 5, 6 years ago, we started saying you get your vitamin D levels checked, and more doctors are getting their vitamin D levels checked because vitamin D is hugely important. Same thing now, we're requesting for you to get checked on your cholesterol. It's ApoA and ApoB lipoprotein. Now, why would a medical doctor not test for this? Because right now, folks, there are no drugs, there's no statins that will reduce or improve ApoA or ApoB. And unless there's a drug to fix the problem, there's no problem. Okay? Guess what improves ApoA and ApoB? Your diet, your food, and exercise, and reducing stress. Wow. But I can't make any money that way. You're right. You can't. So drug companies are scrambling to find a drug that will actually improve ApoA and ApoB. This is the next big thing. So you heard it here first. ApoA and ApoB is what you want to tell your medical doctor. Next time you get blood work, if you go, can you please check my ApoA and ApoB lipoprotein? And they will be stunned. They will be shocked that you even know what that is. And most of them, guess what, will not know what it is. So right now, you know more information than a medical doctor by asking him for this very important test. This is the future of cholesterol tests. So not the ratio, not just looking at HDL and LDL. This is the future of cholesterol, is this marker right here. Okay? Any questions on that? Make sense? All right. So we know the problems. We know the solutions. What we just talking about. Eating better, exercising, stress reduction, detox. And then and only then, after you're doing everything else, the right way is the supplements. That's why they're called supplements, supplementing your diet and lifestyle. Okay? So diet, our number one diet is a Mediterranean diet. Number one in the world to reduce cardiovascular disease. Nothing crazy, nothing exotic, lean proteins, fresh fruits and veggies, organic as much as possible, know your sources, good fats, good seeds, good nuts. We put it right there in your brochure for you. Put that on the fridge, bring it to the grocery store. Be consistent. Be consistent, and don't let one bad meal turn into one bad week, which turns into one bad month. If you fall off the wagon, just jump right back on again, right? Exercise. Do something. Our bodies were meant to move, not sit there. We sit there all day. We drive to work. We go to bed. We drive to work. We sit in a car. We go in our chair. We sit all day. We go in our car to drive home, and guess what? We sit at home. We are meant to move the minimum 150 minutes a week. Do something. Aerobic, muscle strength, flexibility, recommend all three. 150 minutes a week is where we need to be, is what the research shows. 150 minutes a week. I always say, let's start with 1 minute. Can you give me 60 seconds? And that 1 minute shouldn't be counting sprinting to the fridge. Okay? So that's my little joke for today. But let's just start right there. And then the next day, guess what? Give me 2 minutes. Because some people, oh, wow, 150 minutes, I can't do that. That's too overwhelming. Let's just start with 1 minute and build from there. Okay? Now finally the weather's breaking. So now it's the time to get outside, enjoy the fresh air as well. Stress, we talked about that before, hugely important. Stress reduction. Stress is connected to every major, health condition there is. The number one technique for stress, deep breathing exercise. Go into a room, turn off the lights, put earplugs in if you have to, turn off the noise. Count of 10, breathe in. Count of 10, breathe out. Start with 60 seconds. Do it for a minute. The next day, do 2 minutes. Number one stress reducer, and guess what? Doesn't cost you a penny. Free. How about that? Free. Stress reducing. All right, then, once we're doing all those other good things, then the supplements will truly work, folks. They will be magical. They will really work if you're doing everything else. So let's talk about those here. Number one, if you have, let's talk major heart problems. So if you have any major ones, again, the biggies, congestive heart failure, heart attack, stent, AFib, irregular heartbeat, those are the biggies. We recommend CardioStack. CardioStack. We combine 3 different ingredients together. L-Carnitine, dimethylglycine, CoQ10, all in one. So there you go, right? Again, so this putting it together for you. All 3 of these have research to really help strengthen the heart. So let's break these down. L-Carnitine is an amino acid, literally to strengthen the heart muscle. There's tons of studies for chest pain, for congestive heart failure, for heart attacks on this. And some companies, we'll get to that here in a moment. DMG, I mentioned it over and over again. Here's a couple more great things. Again, it has a U.S. patent for reducing all inflammation, and it also has been shown to help lower homocysteine. It's also been shown to help lower blood pressure and also help with cholesterol as well, and it will enhance all the other supplements. All the amazing things that DMG does, and it's quite a list. There's actually a whole book on it in the back about it, and I can do a whole presentation on it, but for today we won't. All right, so here's the deal. 2 in the morning, 2 in the evening, 4 a day, 4 a day. And for what other companies sell just L-Carnitine or Max Carnitine by other companies, not going to mention any names, but you are basically getting a free bottle of DMG and a free bottle of CoQ10 with this. Now, is this enough CoQ10 if you have major heart issues? No. We'd still recommend additional 100 milligrams, but now that bottle's going to last twice as long. 4 a day. 4 a day. It's our number one that we would recommend for the heart. Number 2 formula for the heart is Power Fuel. Okay, this is a powdered drink. I think it tastes like lemonade. I think this tastes really good. This is focusing on the mitochondria, which again is the cellular production and where energy is made in your cells. And these are all the key nutrients that help with this, especially D-ribose. Okay. There's a very famous cardiologist. His name is Dr. Stephen Sinatra. Little brother, Frank's little brother, I always say. No, there's no relation to Frank. But that's an easy way to remember his name. He's written several top 10 best-selling books on the heart. He just, in fact, just wrote a brand new one called The Great Cholesterol Myth. I'm just going to pass that around, okay? In his book, in his many books, Dr. Sinatra talks about the benefits of taking very specific nutrients for the heart. And guess what? Every single nutrient that he talks about in the book is in the Power Fuel, with the exception of magnesium. That's the only ingredient we didn't add in this formula is magnesium, but it's extremely beneficial. So if you are working with your cardiologist and you say, well, doc, I'm trying something here for my heart called Power Fuel, and you give him the literature on, and he's like, well, I don't believe in that. Okay. Or I often get that question, well, my cardiologist never told me about this. You're right. Your cardiologist never did. There is a cardiologist who has. His name is Dr. Stephen Sinatra. He's one of the world famous cardiologists. Your cardiologist is just not aware of nutrition because, again, he's never taken a nutritional class in med school, nor has he ever taken a nutritional class after med school. Okay? That's the difference. Use him as a reference. Read his books if you have heart problems. Awesome books. Okay? Power Fuel also does a couple things as well. We also recommend this for fibromyalgia because the majority of the time it's a mitochondria issue. And we've had people who have had fibromyalgia for 20 years. They notice the difference within 3 to 5 days of taking this for fibro. Also, it's excellent for chronic fatigue. Again, cellular energy. This is not caffeine. Does not crash and burn. This is going to give you energy and keep energy. So you can use this anytime your energy levels drop instead of reaching for that coffee or anything else that's caffeine related. This is excellent. You will not crash and burn on that. But if you have any of these major issues, heart issues, fibro, or chronic fatigue, we start with 1 in the morning, 1 at lunch. 1 in the morning, 1 at lunch. But if you exercise, this is also a great pre-workout energy drink as well. So again, there's lots of ways you can use this.
What do you do for mitral valve prolapse?
Yes, these 3 things that we're talking about. So I would call that mitral valve prolapse. Absolutely, that would be included with major heart issues. So CardioStack, the Power Fuel, absolutely. Okay. So here's the whole program, and right here is how the whole entire supplement program. So CardioStack, Power Fuel, magnesium. So we have straight magnesium called Mag Complete. Mag Complete. So this is the 3 highest forms of magnesium. Dr. Weiner talks about this all the time. Mag glycinate. Plus we added malate, magnesium malate, and we also added taurate, magnesium taurate. These are the most absorbable magnesium out there, and especially these are excellent for strengthening the heart. Okay, so 2 in the morning, 2 at lunch if you are using just magnesium. Okay, I personally, however, recommend the minerals. The minerals has magnesium in it, but it also has all of your other key minerals, especially potassium. So most people with heart issues, it's not just magnesium, it also could be some other things. So this is the most absorbable form of minerals out there. Okay, we call it chelation, what converts it from a mineral to a protein, so you're able to absorb it. Okay, 2 in the morning, 2 in the evening. You can do either one. I personally recommend the minerals versus just a straight magnesium because this has those other minerals involved in it. There's the CoQ10, Ubiquinol 200 milligrams of Ubiquinol or 100 milligrams of Ubiquinol, and fish oil. Fish oil, extremely important as well. 2 grams a day of EPA DHA, the main extract of fish oil, on there. So you can do any of these, or you can do all of them. They all work on different levels, different mechanisms. I prioritize this though, so if you're on a tight budget and you can only do one thing, I start with the cardio stack. Okay? The cardio stack. Okay. Make sense? Everybody with me? Okay?
I got a question though real quick. I don't have any major heart problems. I do have a high blood pressure. Would this be good for high blood pressure?
Well, that is, magnesium is good for blood pressure, but I'll talk about blood pressure specifically here in a couple slides. Okay. With fish oil, wanted to mention this little stat. Okay? Fish oil has thousands and thousands of published studies on fish oil. This is my favorite study of all time. This is in JAMA, Journal of American Medical Association. This is what the medical doctors read and refer to and reference to. Back in 1995, in JAMA, they did a study on fish oil, and what they showed that if you take 1 gram of EPA DHA, which is the main extract of fish oil, for 3 months, you can reduce your risk of heart attacks by 90%. By 90%, 1 gram. When I show this to a medical doctor, they are stunned. They are stunned. They can't argue this because it's in their own medical journals. They just are not aware. They're just have never, nobody has ever showed them this. That is what I do every day. I show them these studies to make them aware. Okay? So 1 gram to prevent, 2 grams if you have any major heart issues. So with our omega-3D, 3 a day. 3 a day gets you to that 2 gram mark. It's one of the strongest fish oils out there on the market. Okay? And recently we came out with a new testing program on our fish oil because every supplement company out there has a fish oil and everybody says theirs is the greatest and best ever, and we realize that. So there's an international standard out there called International Fish Oil Standards Program, IFOS. And there's really a 5-star criteria now when it comes to fish oil. So you get a star for passing all World Health testing categories. You get a star for greater than 60% concentrate. You get a star for oxidation, PCBs, and dioxin levels all below detectable limits. And so we hit every single star that you can hit. And we have that flyer in the back for you on that has all 5 of these. So this is really separating ourselves from all the other fish oils that are out there on the market. Okay? And these are the questions that we want to ask if you're buying fish oil from another company. Do you have the IFOS standard testing? What? I never heard of that. Yeah, that's the newest of the new. We also put our lab testing on our website on our fish oil. This is really unique in the supplement industry, but this shows you how much testing that we do that are willing to put our money where our mouth is, guaranteeing purity and potency on our fish oil. Not many companies do this. Why? Because our competitors who sell fish oil can test us, and if this is not accurate, they will use it against us. Okay? That's why not many people do this, because we open ourselves up. But the testing that we do on our fish oil is so extreme that we feel extremely confident. When we go through these different labs to get testing, the testing labs say, are you sure you want this? Because no other company has ever done this type of testing. We're like, yeah, we do. We do. So you can pull this up on our website at any time, nutritionalfrontiers.com, the different testing that we do on our fish oil. On our megas, we also have vitamin D, very, very important role there. Okay? So we have lots of different choices on the megas. I just mentioned the omega-3D. We have that in soft gels or liquid. We have krill oil. We have an enteric coated option, so especially if you don't have a gallbladder, okay, that you have issues trying to digest fat, that's where the EC would fit in. DHA chewables is great for kids, for brain development with children. And we do have a plant-based vegetarian oil called Omega Synergy. It tastes like blueberry yogurt. So if you're a vegetarian, that's the one that we would recommend on that. So you can do any of these or all of these. Not all of them, but you can do any of these to see the, you pick and choose what you like. But if I was specifically looking at cholesterol and triglycerides, I would recommend the krill oil. The reason why, because on head-to-head studies, krill oil has been shown to be 27% better, raising or lowering the bad, and a whopping 38% improvement in raising the good in 3 months. And the fish oil, still you saw benefits from fish oil, but you saw much greater benefits with the krill oil at just 2 a day. At just 2 a day. So if we're focusing on cholesterol, I recommend the krill. We do not want to do both. We do not want to do krill and a regular fish oil because we've seen studies where they both compete against each other and you're not getting maximum absorption. So you're doing either one or the other, but I recommend the krill. There's 3 areas I recommend krill. Cholesterol, PMS hormonal issues, so everything from PMS all the way through menopause issues, hormonal issues, and C-reactive protein, which is an inflammatory marker that you can get tested for. Krill oil has been shown to be better than regular fish oil. Okay, if we want to try a natural approach instead of taking the statins, we've come out with a brand new and improved Cholesterol Care 2. Cholesterol Care 2, it's brand new. We just got it back in for the Weiner Wellness event. What we've done, if you're familiar with this in the past, this used to be in a box. It used to be 2 bottles. We converted into just 1 bottle, okay? And we actually improved this as well. So this has some of the top researched ingredients to raise the good, lower the bad. So it has plant sterols, especially beta-sitosterol. We're using the highest yield possible, 90%. We also have polycosanol. We also have gugolipid. And we also added some non-flush niacin to it. We also added a little bit of DMG into this as well. Very simple now. You're just doing 2 in the morning, 2 in the evening with food. 1 bottle is 1 month. Here's the key, though. To change cholesterol, it takes 3 months to change a blood test, okay? Which is why it's exactly the same time it takes if you are on a drug. So somebody can't say to you, oh, the drugs work faster. No, they don't. If you were put on Lipitor, medical doctor would not test you for at least 3 months later, which is exactly the same length of time that we would recommend this. So this is the most advanced cholesterol formula on the market. And so again, we would transition. If you want to work with your doctor, let him know you're trying something natural. As your numbers improve, hopefully it can lower and lower and get you off of the medication. Okay? So that is for the cholesterol. Last but not least, blood pressure. So this is a major problem. So as I mentioned at the beginning, with the side effects of the statins, the side effects of blood pressure are twice as much, at least twice as much. And everybody that I've ever asked that question, you aware of the side effects? Can you repeat them back to me? They have no idea. They have no idea, and usually once you go on 1, then you go on 2, then you go on 3. They are very, very dangerous, folks. Extremely dangerous. Okay? So, our number 1 formula for focusing just on blood pressure is called 7 flowers. It's called 7 flowers because it's 7 different herbs that have been used in traditional Chinese medicine in Asia for over 2,000 years. So anything that's lasted that length of time, something must be working, right? Or it wouldn't even last 2 years, let alone 2,000 years. So this has a very, very calming and relaxing effect. This works really well, especially for the type A stressed individual. Has a very calming, relaxing effect. Also can be very helpful for glaucoma, eye pressure. So we look at blood pressure and eye pressure very similar on a nutritional level. By the way, there's only 1 source in the United States that makes this. And Dr. Weiner is one of the few people in the world that can actually get this right now, the original recipe. So there's some supplement companies that claim they're using 7 flowers. They're not. There's only 1 source out there, and Dr. Weiner is able to get this. Okay, so this is the original recipe. Here's the key with this, and this is what most people are not taking this properly, is what we found out. And unfortunately, we cannot put this on a bottle. We cannot put this on our tech sheet. The FDA will not allow us to, because then we're making claims. So you want to make sure you're taking this properly. So this would be if you're not on any blood pressure medication. Okay, so I want to make that clear. If you're not in any blood pressure medication, we start with 6 a day. 3 in the morning, 3 at night. 6 a day. They're teeny tiny micro tabs. You can put all 6 on your fingernail. Very teeny tiny. After a week, we want to check your blood pressure. Not next day, not 5 times a day, weekly. You will drive yourself crazy if you're checking your blood pressure 6 times a day. Because it's just natural. You're going to have ups and downs, ups and downs. So I always recommend you go once a week on a day you're not working, day off. At the same time, you want to keep all the variables the same, okay? If at 6 a day after a week, your blood pressure is where you would like it to be, then we start decreasing it by 2. Okay, so the ideal situation is 6, 4, 2, 1, 0. Okay, yes, the whole idea is not to be on 7 flowers for the rest of your life. The whole idea is to, as your body improves, to use less and less and less of this. Now, once we get it down to 0, I would check it every couple weeks. Unless you have a stressful event that comes up, then I would check it at that time. And if it ever does raise a little bit, then we go back to 2 a day, okay? But we want to check it weekly. That's the key with this. Most people do not do this. If you were at 6 a day and your blood pressure has not improved, then we increase it by 2. So in that scenario, it'd be 8, 10, 12. 6 in the morning, 6 at night. If you take 12 a day of 7 flowers for a week and you don't notice one difference at all in your blood pressure, then we know that this is not for you. Okay, and we're going to try a different approach at that point. Come see me and I'll give you some different options. But most of the time, 6 works extremely well. 6 works extremely well. Now, if you're on blood pressure medication, this is how we dose it. We just start with 6. An hour apart from taking your blood pressure medication. An hour away from it. And the second that you start this, we recommend you make an appointment with your PCP who prescribed the blood pressure medication. Okay, you want to see him as soon as possible, make an appointment. When you make that appointment and see him, you want to have the literature on the 7 flowers, and we have it in the back on the handout in the back there for you. You want to hand that literature to the medical doctor, and you want to say this: Doc, I'm trying something natural for my blood pressure. Here's what I'm taking. Give him the text sheet. As my numbers improve, can you help me lower my medication? Okay? You have to say it exactly that way. If you say to the medical doctor, yeah, I bought some pills from my chiropractor, not sure what it is, but I want to get off all my drugs, that will not go well. That will not go well. They will tune you out. In fact, they might increase your medication just to spite you. Okay? So there's a right way and a wrong way to present this to a medical doctor. So you want to practice that verbiage before you go in, because when the spotlight shines and you're like, oh, I forgot what I take, I forgot the literature, oh my God, I forgot. You want to make sure you have the literature in hand it to him. He will have no idea about any of these ingredients, not at all. He'll act like he does, but all he wants to see is the numbers improve. That's it. So that's how we do it. That's how we do it. That's how we talk to the medical doctor. Just lower my medication. Not get off, not stop. Never say that to a medical doctor with your drugs. Never, ever say that to a medical doctor. I want to get off all my drugs. Never. I want to lower my medication. Can you help me lower it? That's how we do it. Okay? All right, folks, my time is up. I have extra copies here. Dr. Weiner's going to be speaking very briefly here. So, again, keep that in mind. I will be in the back. If you have any questions on any of these, come see me. Again, everything is 30% off, so now's the time. Hopefully that made sense. I made extra copies, but have a rest of a wonderful day. Thank you. Have a good one.